For 60 years, Texas Children's Hospital has been one of the great centers of excellence for pediatric medicine. We started out with 106 beds. That first year, we treated 4,558 patients. The 1970s brought us our second physician-in-chief and chairman of the Department of Pediatrics at Baylor, Dr. Ralph Feigin. It was in October of 1989 that I moved from Methodist Hospital next door to Texas Children's Hospital to become president and chief executive officer. In the 1990s, we became the largest freestanding children's hospital in the country. We implemented Texas Children's Pediatric Associates and Texas Children's Health Plan. In October of 2006, the board approved Vision 2010, adding 2 million square feet of space to Texas Children's at a cost of about $1.5 billion. And now in 2014, we're going north. We're going to break ground for Texas Children's Hospital, the Woodlands.
If your child is ill, particularly seriously ill, you want your child taken care of in a facility that sees these conditions and seriously ill children day in, day out, every day of the year. Not a facility that is taking care of a seriously ill child once a month or once every other month. It's just as simple as that.
St. Luke's really reached out to Texas Children's when we were building the campus here. And we did that because our vision was always to build really a world-class medical center campus here in North Houston.
We've been in the Woodlands for a long time, over 10 years, providing outpatient services through 4 Texas Children's pediatric practices, by having a great relationship with St. Luke's Woodlands, and taking care of children in their emergency center through our faculty and physicians and nurses. The largest health center that we have at Texas Children's, it's based there at St. Luke's Woodlands. And so we've been there for a long time.
Texas Children's Hospital was birthed by the community with the idea that we would serve the entire community. You know, it's only natural that as the Houston community has grown over time, our services have grown and our geographic reach has grown to keep pace with the community itself.
What we found early on is that the Woodlands is a very sophisticated community, and they have an expectation, which was, I believe, George Mitchell's vision, which was to build a master plan world-class community here. And in fact, Mr. Mitchell did just that. And so, you know, I think that's right in alignment with what the leadership of Texas Children's has always done, and I think it's right in alignment with what we chose to do here at St. Luke's, and that is to really build world-class care and really redefine how healthcare is delivered in a community.
It's nice to go into an area such as West Houston, the Woodlands, and be able to see how you can move the bar. And to have those services readily available, I think is very valuable to communities. Because every once in a while, something that's routine is not routine.
So I think it's going to look similar to our West Campus. We've already done this in Katy, and it's a huge success. We're probably going to have somewhere between 18 and 24 rooms on startup, double-boarded pediatric emergency medicine physicians, as well as probably some pediatricians working our ER. So that's the Kangaroo Crew, our best friends with regard to the emergency department. We transfer a lot of children from the Woodlands down to the main campus, and from West Campus to the main campus vis-a-vis the Kangaroo Crew. There's usually a critical care nurse, a critical care paramedic, as well as the drivers are usually paramedics. On occasion, we'll actually transport with a physician, depending on the seriousness of the case and what might be needed en route. So it's like a passport directly from the EC at the Woodlands to the intensive care unit here at main campus.
When the Kangaroo Crew team walked in, I swear it looked like the astronauts getting off the space shuttle. They were calm, cool, collected. They had all their own gear. They knew exactly what they were supposed to do. They were like the Navy SEALs of the Texas Children's Hospital. And from the nanosecond they touched Bennett to the day the valet guy waved to us as we left Texas Children's, every single person that touched my child or had any interaction with us as parents was amazing. They were perfect, they were wonderful, they were caring and skilled and kind and had all the tools they needed to fix this little guy right here.
We all know that one size does not fit all when it comes to health care. And children and babies are special, and they need to be taken care of in a children's hospital. They need to be seen by a pediatrician and a pediatric subspecialist and a pediatric surgical subspecialist.
In the ER here in the Woodlands, they were wonderful, and I love that they saved him here. But to be honest, you could tell a major difference. They couldn't get him intubated because they only had an adult intubation tube available to him. They had to call in a specialist, which took valuable minutes in the ER. And at Texas Children's, you could see, they knew exactly what they needed, what size this child was, all of that stuff. They had it all there.
The way you get used to interacting with the patient and interacting with the parent and interacting with the sibling. I think it's all those things that go along with just doing that day in, day out, all day, every day. You get better at it.
So this will be significant for this community. Parents will not have to drive more than 30 miles into the Texas Medical Center to receive not just general care, but really specialized pediatric care.
And the reason we're doing it is because we run toward the problem, we run toward where the children are so that we can deliver on that equation of right care, right place, at the right time.
And building this new facility in the Woodlands is an expression of our commitment to that principle.
The electronic medical record does keep us kind of connected, and sometimes it's not so much the analogy of a satellite as just a longer hallway. If the third floor in this hospital and the ninth floor aren't satellites of each other, then maybe the third floor in the Woodlands aren't satellites anymore either. It's just a longer hallway.
99% of what we do can be done at regional facilities off of the main campus in the Texas Medical Center. And we expect that the Woodlands facility will fit that bill.
I think it's compelling for all of us to support Texas Children's and to be ambassadors of Texas Children's and to have a sense of pride that we are lucky enough to live in a city and certainly to have leadership at Texas Children's who's willing to invest in our community to bring that world-class services to our children.
It's a good hospital, and they might just save your kid's life or yours.
Texas Children's more than earns the right to ask for help to continue to do the most amazing miracles and things that they do.
As a parent, I have two boys who have developmental needs, one with pretty significant neurological needs. There's no one who can appreciate the significance more than myself in terms of wanting to have access to the best pediatric care anywhere in the United States. And to have that here in my community where we live is significant, most significant, and exciting, very exciting.
Please help us continue to do this most amazing work.